Here are some heart failure pearls picked up from a conference talk earlier. Alpha blockers should be avoided in hypertensives with heart failure as they can cause retention of salt and water. Number needed to treat in heart failure trials is lower for carvedilol compared to other beta blockers. Stroke risk in atrial fibrillation increases when they develop heart failure and calls for anticoagulation. But dose titration may be difficult due to associated liver dysfunction. Prolactin has a role in peripartum cardiomyopathy, and bromocriptine has been found to be useful in the treatment of peripartum cardiomyopathy. There is a 12.1-fold increase in atrial fibrillation in primary aldosteronism compared to essential hypertension. This is thought to be due to atrial fibrosis caused by aldosterone excess. Thus, aldosterone antagonists have a role in preventing atrial fibrillation by reducing atrial remodeling. Central sleep apnea in heart failure may respond to small doses of theophylline. Higher doses can increase the tendency to ventricular arrhythmias. Another modality evaluated for central sleep apnea is pacing of the phrenic nerve during the apneic phase. Bioavailability of oral torsemide is higher, about 80%, in heart failure compared to furosemide, about 40%. Furosemide infusion is useful in acute decompensated heart failure, but high cumulative daily dose can cause ototoxicity. Ultrafiltration is useful in treating pulmonary edema in renal failure. Ultrafiltration is the removal of excess fluid in the body along with dialysis using negative pressure. Care should be taken to avoid hypotension during ultrafiltration. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.